Testing. 10 minutes. I mean, people gotta get, 6:00.
Okay, 6:00, let's go.
And it's gonna be about a half hour late, you said.
Okay, do we have
Yeah,
a
it's on
quorum,
fire.
we can start? Oh, you've got your logo on under there too. Oh, yeah. Okay.
I used to see
Right.
it. Yeah.
Let's call the meeting to order at 6:01.
Okay.
A minute behind schedule. Nice to see everybody. We are going to start today with privilege of the floor. I understand we have two guests with us today who are going to speak on a specific topic that we will be reviewing a little bit later in the meeting, but we will do our public comments right off the bat, if that's okay with you. So you have 3 minutes to speak to the board. You can introduce yourself and tell us a little bit about why you're here and what topic you're talking about, and we will listen with open ears.
Hi, my name is Terry Tremblay. I am the owner of the former Panama Pizza that was in Panama, New York. I was responsible for doing the water testing every day to verify that the water was safe with the chlorine levels. It was not water that was consumed by the public, but it was used for my cooking. And I did the testing every day and I wrote it down on the sheet. And I thought I took a picture of May's test on June 5th. I was going through a lot of emotional stuff at that time and physical challenges. And I had taken a picture of the report and I thought I sent it like I always did, and I didn't send it. My pizza shop closed up on June 21st. So I didn't realize, because I was closed, that I needed to file the June's report. I thought because we closed prior to the end of the month. And I ended up having to leave town for a month. And when I got the notification in the mail, I was not here, so I didn't realize that I needed to correspond with them. I had tried to, and then when he got the letter, I tried to call, but by then it was too late. And the fine was, the hearing was already implemented. I took my pizza shop responsibilities very serious. The health of the community is very serious to me, and as far as that I failed in my responsibilities of not reporting. I did the report, I did the work, but I didn't send the email. And a fine of that amount right now would be very financially hurting to me. The pizza shop is closed. The last day of operation where we sold to the customers was on June 21st. And I will not be opening another establishment in the future. And I never had a bad water report. Everything was always within guidelines. But I failed to set the report in.
Over what period of time were your reports always on time? How long was the shop open?
From July 1st, I opened on July 10th of 2024.
So over 20 years.
No,
Oh,
2024.
2024.
So I was open not quite a year.
Okay, 2020.
Yeah.
Sure, okay.
Did I have the dated picture on my phone of the date I took it. It's the same date that I signed it, which was June 5th. I went into the email and I didn't push send. I was negligent, I'm sorry.
Any other questions? Thank you for coming and sharing your experience with us. We will take that into account. Thank you.
We'll get back to you.
Yep, thank you guys. What?
I think we get to that later, that topic
That'll
later
be
in our
the
discussion.
hearing officer recommendation.
There's no other privilege of the floor? Okay. Let's jump to the approval of the minutes. I believe they were sent out ahead of time.
So move.
Okay. Second.
I sent one tiny correction, but it's just a FYI. First sentence, HIPAA, 2 A's, not 2 T's.
Oh,
I did send that in, actually. Or was something in the minutes, I hit reply and I sent it in.
It's on.
it's,
Hey,
it's,
to multiple
it's right
places.
on the first
Yeah,
paragraph.
it's in multiple.
Oh, it's in multiple places.
Yeah, I think there's 3 in my recollection, but.
It could be,
Regardless,
it could be the most misspelled acronym.
Yeah. For some reason,
But
that one got
your
my
eye picks
draw,
it.
so I
Yeah.
saw it.
Are there any other edits that were needed to the minutes? Okay,
I'll amend. Okay.
so moved with the amendment?
Yes.
Okay, and Don, you were the second on this?
Sure.
I believe. Okay. Old business? I don't see anything on the agenda. Is there anything anyone wanted to bring up? We're gonna just keep.
I don't know.
Something?
I'm sorry, old business, did you want to bring up? The buying stuff? Oh, thank you. Had my phone here. So there was a topic of discussion last meeting, asking about any follow-ups and updates, regarding wind turbines specific, to Chautauqua County, or also just nationally or internationally, even research that had been done on that topic. In that timeframe, we did ask one of the fellows to delve into the research and put together a paper, which we have been provided. So Jessica and I will review that work and have something to you by next meeting.
It's not directly related, but literally at 3:30 today, I had a meeting with Nate Aldridge, himself, the Chautauqua County Partnership for Economic Growth. And we were discussing wind turbines, but we were also discussing solar farms. And he was talking about tax breaks that are, says will sunset on, I believe it was June 1st next year. So he said if something is not permitted with a shovel in the ground by that date, they won't get tax break. So I think he thought that the number of assuming that's an accurate statement, and I think knows his business. I think it's likely that we'll see far fewer of these types of projects.
Yeah, but could that deadline be extended?
Anything's possible. I'm not going to get it. I think it's political. There's all kinds of stuff. I'm not going to get into that piece of it. But I'm just saying it was interesting, and I wasn't going to bring it up. But when I heard wind turbines, I'm thinking it just. We had a community foundation board meeting. He was at, and we just among many things that can hospital water projects.
You want to addend our agenda?
No.
Okay, anything else on old business?
I got one thing, the lead rental registry, Jessica, you were waiting for New York State guidance. Did you ever, anything? Still waiting?
Yeah, I just attended a conference of environmental health directors and so the original guidance had gone out for public comment, and due to the plethora of comments they received, they made some substantial changes to it, to the regulations. So they are getting ready to release those regulations again, but they'll be going back out for a 45-day public comment period before we're actually able to sign, seal, deliver, and start implementing them.
So we're probably a couple months away from
the platform itself. Jessica's team is doing a great job in terms of like planning to get things ready, because
Oh,
there
sure.
is so much crossover work with the city of Jamestown is doing their own rental registry and sort of healthy homes approach to things. So, the silver lining is that it's given their team some extra time to plan on that side of things, which and to work on the backlog. Unfortunately, some of these properties, they fall off the radar because families move, they're hard to get a hold of. The landlords are their own brand of hard to get a hold of and nail down on things. So the staff that we have brought on, it's honestly we've been a nice sort of lead up into this lead rental registry that we're working on plowing through some of that old stuff that we lost track of a little bit and getting those things wrapped up. And a lot of those homes that we're wrapping things up on will be homes that fall into the lead rental registry. So if we can get everything wrapped up nice now, then going into lead rental registry, they should be nice, easy inspections for our staff to do because we'll have good history on what the property is and where the, what the hazards were or still are.
Okay, thanks.
All right, we'll move to agreements to settle. Back to you.
Yeah. So you've got, you have a couple of pages here of agreements to settle. Unfortunately, the same types of things that we see, missed monthly reports, some missed sampling. Unfortunately, this is what we see from time to time. There's a lot of folks or a lot of facilities on here that the names of which you've seen before. And we're sending out the notices as we are required to. I will say that our water program was audited by the New York State DOH folks, and they did make a point to say that we do a really good job of following through on our violations and comply and doing our part of what needs to be done to comply with New York State DOH requirements for us as an office. So I don't like seeing this long list of folks, but we are doing what we need to do to stay in compliance.
This has still got to be a really small percentage of everything.
Oh, absolutely. Yeah. I mean, in every system, has different requirements depending on the size and the type of business it is. Some of these facilities, so everybody has to be submitting some sort of monthly report, either, monitoring what their chlorine residual levels are or monitoring the UV light and how well that's operating. But as far as the actual samples that get submitted, those vary significantly depending on the type of business and the size of the business and whatnot. So some of these facilities have to do monthly samples, some of them have to do quarterly samples, and then there's sampling other than the basic biological sampling that we do here in-house. There's the nitrates and the PFAS and all sorts of different things depending on the individual facility.
That's okay. I feel like you have to explain this to me every time or one of us here, but I recognize some of these names on page
Same
2
name.
as repeat names, but they're listed under the one violation. Is that just one violation this month, but it's not noted of historical violation?
Correct. When I present these to you, I am presenting the active violation that was not settled since the last meeting. Does that make sense?
Okay. So we
Yeah.
might be seeing the same name the second time because it's still not settled.
Well, no, so I take it meeting by meeting with you folks. So whatever was not settled at the last meeting starts over again and was on this one. So we send out different notices, usually every other month or so, depending on, because again, there's quarterly sampling that needs to happen. There's monthly sampling that needs to happen. So we usually send out those notices of violation at least every 3 months, if not every 2 months, depending on how many things are stacking up. We have scheduled Board of Health hearings every other month. So we send out notices to follow that schedule of when those hearings are. So when I present stuff to you, it's only the violations that you had not yet seen. It's not necessarily the compilation of everything with the full history of that facility.
But perhaps part of the question is too, are there repeat offenders? Maybe not necessarily on the list, but we're recognizing some of the names that maybe 6 months ago were on the list because they didn't do whatever. But I think you also told us after 1 year or some period of time, kind of drops off, the clock resets.
Well, so there's a TUPA with the tobacco, and that has its own resetting for the points. With the water, you guys had decided on that increased, fine schedule with
Yep.
with the, increasing fine level based on repeat fines.
Yeah.
Yeah, so we did talk about making that sort of calendar of when things start over as, 1 year, or actually, I think it was at 3 years, because some of these samples are not required except once every 3 years. Yeah.
Yeah.
Yeah. So that's why some of these fines, let's see, so yeah, some of the fines are gonna be larger. Trying to find one that's an example. Guess I don't have one, it's an example in here with the new building of the fee schedule, yeah. Because, yeah, and I mean, some of these folks own multiple facilities too, so you may be seeing the operator's name, but the facility itself may be different. Yeah,
I think the question is there a special ledger?
we have a ledger. I mean, I don't know how.
Well, it would be nice for us to see if this is a person who has paid in the past, but has continued to repeat offend. And we see the name, and we say, boy, that looks familiar, but it's just a single infraction, so to speak. But this is a person who's has frequent flyer miles with us, so to speak.
So I can work on how to present that information to you folks in a digestible manner.
If it's something that impacts the fines or whatever, I mean, if we can help you, the
Yeah.
last thing I do is make you busy work. So we can look at something that we're not gonna. So
And
that's
decide
interesting.
where we're never gonna go.
Well, so what I would say is, so we had talked before that, so these are the agreements to settle when we send out the notice and they say, yep, I'm guilty. I did this or didn't do this. I'm gonna pay the fine. And I will say that when it gets to an offender or a facility that we keep having a lot of problems with, we don't give them this option for an agreement to settle anymore.
Yeah,
Those are
that's
the
right.
points where we say, no more
Right.
options, you're coming to a hearing.
Right.
And then you have to do that.
That's adequate.
Yeah.
Yeah, so you're doing.
Yeah, okay.
Okay.
You just want to help without being.
Well, and that's,
It's
yeah,
nice to have the context to sort of what you're saying.
Yeah.
The way you sort of read on your fee schedules is basically building that context in for you, where you can see the accumulating.
but I do appreciate your support though, and wanting to nip some of these things in the bud a little bit. I appreciate that. So that's agreements to
Okay,
settle.
shall we move on to our hearing officer recommendations?
Sure. So this is the, facility that was spoken to earlier, during the public comment period. These folks, they did have this Panama Pizza facility. It is our understanding that they closed the business, middle of June of this year. However, prior to closing that business, we were missing the May report. We were also missing the June report, because although she did close in the end of June, there were a number of days in June they were open. So they should have submitted a report to sort of wrap up that business. Part of the problem that we have as regulators is that nobody told us that they had closed the business. So if we don't know that you've closed the business and you haven't done the things you were supposed to do, we can't work with you on any of that. So, so those were the issues of the missing daily reports. There were the May report and the June report were missing, but there were also the second quarter monitoring results that were missing. Again, the problem is that according to us, we simply did not receive results by July 10th for the microbiological sampling and the nitrate sampling. They closed on June 21st, so technically they weren't open the entire quarter. However, nobody told us that. So we treated it as though they had been open and issued the notices, of violation. So in consideration of, the very specific circumstances for this facility, under the fine schedule that has been implemented by the Board of Health, they should have been paying a fine of $100 for the missed May report, $200 for the missed June report, $200 for the missed microbiological sample in the second quarter, and $200 for the missed nitrate sample in the second quarter. If you added all that up, you'd be looking at $700, in consideration of the fact that this business closed. We were still very conscious of the fact that we did have to take this to hearing. And so we had to pay our hearing officer. It took our extra time, but we want to be somewhat sympathetic to this facility. So we were willing to sort of settle on the idea of a $400 fine rather than the $700 fine. So
Did they
that's-
know it could be 700?
They talked about it in the hearing, yeah.
But she wasn't present.
She
was.
was,
She was
yeah,
present.
they were both present at the hearing with the Board of Health hearing officer, Betsy Stager, yes.
Were they made aware of what's in her written recommendation?
No, they don't see it.
So they,
'Cause
in their mind, it was a $700.
Well, no, they would have said, no, because Natalie said in the hearing that we would be willing to do the $400 fine, because that's where Betsy came up with that number. Because at that hearing, Natalie Whiteman from our office, as well as the two folks, the respondents, Betsy Stager, and then our county legal counsel would have all been in that hearing. And so Betsy typically asks us what we think.
I'd like to at least ask us to consider, I mean, I don't know what her health issue was, but it sure sounded significant. She closed a business, small business. I mean, I don't know, because I don't know what the communication is, but it might be reasonable to think that if the business wasn't open till the end of the month, a report wasn't needed, or maybe I had a question, is that a possibility? I mean, I just want to make sure that and I understand 700 to 400, but I appreciate the fact that they came. They seemed, honest, direct. If all the other ones were out, I mean, we didn't ask for her to see your phone, but I've done it. You send it, if you hit, but you forget to hit send. I don't know. I mean, I cover our costs, but I'm not sure that. I'm just trying to think of, it was my family, parents, friends trying to run a business. Are we holding it to, I won't say too high a standard, because we hold everyone to the standard. But I wonder if we could, give them a little more slack.
I would second that, provided we cover the cost of the hearing officer. And, at side of me, we're sitting here at the Board of Health and we want to implement, but there's a human side of it too. And we know these families that live in the community and how hard it is to run a small business. So as long as we cover the hearing officer cost, I think we can probably look at a lower number. So they'll still feel that they were responsible for something. And the Board of Health, again, we are community members too, was considerate.
Just to clarify though, the quarter ended on June 30th,
Correct.
so they were open 95% of the quarter.
Yeah.
So, I mean,
But the other thing is they're closing up a business that's obviously failing, or
Yeah.
they couldn't manage it. It's probably not the first
Yeah.
thing on their
Right.
docket, and they're
Sure,
scrambling
other
probably
issues.
to cover whatever costs they could and whatever else, whatever other disaster was going on in their life. What's our hearing officer cost?
So, yeah, hearing officer alone, but then you also might want to talk a bit about, county attorney. time.
So,
And
so
That
hearing,
was time.
so hearing officer alone, we are required to pay a 2-hour minimum anytime Betsy deals with a case. So that would be $200 for her time, plus the county reimburses her the mileage to travel to Mayville to hear the case. So I believe her mileage is about $37 round trip.
250.
Yeah.
I suggest maybe 250.
But we got the county attorney. We've
Yeah,
got,
but that's the person's employed, right? I mean, it wasn't incremental.
Yeah, it's just some cost there.
Or they did that or something else. I mean,
well, they could be doing something else.
It's really hard to get them here, so we.
Yeah,
It is-
we
it
are
is
very
difficult.
short, we're very short on attorney.
but we don't, I mean, we
No, I-
don't do it much. And I just,
Yeah.
just trying to again, think of the
Yeah.
human element. It's
I did appreciate
it's-
that they came and
Yes.
spoke and that she verbalized that she cares deeply about the public health of the community and that is not in any intention or disregard for that to do this, which I think speaks to our mission.
And she's never had any infraction previously.
Not that I'm aware of.
Okay.
no.
She was only open for 9
She was
months.
only open-
That doesn't matter. She had to report, did she not? On a
Yeah,
monthly
she would have had
basis?
to do monthly reporting.
Okay.
In less than a year, so I think you'd know about it if it was
Yeah, if she were,
frequent flyer
yes,
or even a,
she'd be on the radar, yes.
Mhm.
I don't know, for the purpose of a motion, I'd make a motion 250.
I'll second that.
Is there any further discussion?
The only further comment, didn't write a little letter as to how we came up with that. We do have incurred direct costs as a result of that. And there are certain mileage and here we gotta do it, but we're empathetic to what she said. I mean, assuming the motion passes it.
That's the answer.
No, because this is their, no, Betsy doesn't have any part to play anymore. This is me taking the information that the Board of Health chooses to implement and then writing the official Board of Health order.
I mean, it's a pretty unique circumstance. If anything, we've been going the other way.
Right.
How do we increase? So,
If they were so open, it'd be a different story.
yes,
Can
totally
I ask,
different.
the $200 fines, those were like the minimum or the standard?
Yeah, those are based on the fine schedule that you guys voted in. Cause it used to be
That's a
$100
first offense.
per
First
offense
offense.
across the board. So then we went and looked at, what does it really cost to do a sample? And
Yeah.
made the fine at least, ding a little bit harder than it would have been to actually do the thing.
So we are kind of going against our recommendations. And I understand there's circumstances. I really do,
Yeah.
but we've already gone below what we've already recommended, so. And I believe her. I don't believe her, but
Yeah.
sometimes it's hard. You know,
It would have been
I'm
so
sure
much
you-
easier if she had just called to tell us she was closing.
Yeah,
She probably was or something. She's got 18 things in it. Yeah, the business failed. Probably calling the Department of Health is not,
First thing.
I don't know, I didn't even
If
think
she
of
had
it.
health issues.
maybe she should.
I mean, I appreciate and just playing devil's advocate to speak our truth, this is a restaurant, so it's a restaurant permit and a water supply that we should have been aware of.
I made a motion. It was second, voted up,
Yeah.
voted down. I just think you gotta.
Yeah.
I don't know. I think we can just increase the fine, which we did, and we should have. And there's a lot of freedom fund get really upset about it. But I don't, to me, this is not that. It's a special case, so that's why.
Can
Normally, I'm one who was like we gotta do more. We gotta increase these things.
Can we say something in the letter, like in light of the fact that your business has closed or something, you know what I mean? So it's not, so we don't have every
Precedent?
hearing person in here.
I think that would make the letter more personal. We want to keep it business-like and
Yeah, I was gonna say, I
whatever,
think
just,
letter isn't the right word. It's a
yeah.
whereas,
Notification.
whereas kind of document.
Oh.
Yeah.
Can it be a whereas? We appreciate the fact you came and talked to us. But maybe, I don't know, I just,
We
Put it
could
in
put
a cover
something like,
letter.
whereas special circumstances considered by the Board of Health, we could put something. like that.
you
I
don't
think
want to
that
be
would
on
be great.
precedent for sure. Like, well, you did it for them. Well,
Yeah.
whereas it was a special case.
I do think this
very entirely validates the work that you all do as a board for a small community. I think, you know, to Jessica's point, I mean, there are certain things that we have to do, just permitted, mandated requirements. So I think that this really speaks to the fact that this does bring a human element, that this is a small community that you are taking care of and taking into consideration. So from the public health standpoint of that, we appreciate your work and discussion on these sorts of things.
Also, I think what happens if they don't pay.
That's right. I was thinking
do
the flip
250.
side is if she's broke and has gone out of business, we're gonna be dealing with
What do you
them
get,
not
250?
paying.
Could I make another possible suggestion for a whereas? As we understand it now, she has no intention of opening another business in Chautauqua County in the future. But perhaps within the Board of Health order, there could be a whereas prior to opening a new establishment within Chautauqua County, this will be satisfied, you know,
In entirety.
yeah.
But also, I mean, letters by committees don't work really very well, but still, maybe if she doesn't pay it within 60 days or something, it reverts to $400. I don't, I mean, it just, you want to get paid, or we're gonna be talking about it the next meeting. You know that 250? We never got it. Now what do you want to do?
If you make it
Well,
400, you won't get paid.
Yeah, true, that's also
She
true.
doesn't have any money.
Right.
Well, this was,
She wants
that's
to
why.
win. We can't, we got the right cost.
I think we got a
If you're
motion on the
pleased,
floor,
yeah.
if I'm not
Yeah.
mistaken.
Discussion.
Yeah, discussion.
That's why it's called tailgating.
Yes.
Should we call a vote on the motion on the floor for 250 with a, not the letter, but the whereas clauses included, specifying that we recognize this is a unique situation and whatever. What was your last part, that to pay before any opening up any or
New
payment is
facility.
yeah. Payment's required anyway, but especially if you're gonna open up. a new facility.
Right.
Yeah. Okay, that's kind of a messy summarization, but, can I get a call for who's in favor of that plan? Okay. Anyone opposed?
No.
Okay, yeah, one opposition and 6 in favor. Okay. Is that the only hearing for today? We next have quality assurance meeting minutes for review only.
Oh, no, I didn't realize that Wendy was putting these in here. So, I mean, the quality, we do these meetings quarterly. It was a very short meeting last time because it was just Wendy, Sharon and I present. We have some spots to fill, on that committee. But we review, different audits, different, tools that we're looking to put into place for new audits. And every, division has a turn to present anything new that's happened in their division and the outcomes of those audits. And discuss if there's room for improvement, where we can see that improvement.
Yeah, well, this is, I mean, have you all ever been brought this slide before? Yeah, this is sort of unique that it's in here, really only because QI is really part of the larger umbrella of compliance that we do, and so many of our funding sources require different compliance, regulatory compliance and things from us. So it really is difficult to capture all of that compliance regulation in anything that we do, but QI is sort of part of that. It's just quality measures that are put in place to ensure that some of the services that we offer are specific to working with individuals and individual health in the community, that is being done well and ethically and within the bounds of compliance standards. So again, I mean, interesting that it's in here, wasn't aware of that, but there would be a much better way that we could actually present this to you, because this is just very limited look and picture it. But good for you to review and to know that we do these sort of things.
Anything else under new business before we move on to the director's report? Hearing none, Lacey?
Hey,
Yours.
wonderful as always to be with all of you, especially on the Bills Dolphins evening. I have actually a quick sort of report tonight that was not planned, I swear, but just wanted to make you aware of a couple of exciting things. Quieter this month and a half, just because we were really right kind of in the heart of budget process for the county. So a lot of attention, specifically of mine, focused there. Although, you know, I can say very proud of the budget that we have put together for this next coming year. The team leaders over the past 2 years, really now that I've been here, have been excellent partners and help in strategic planning really for the department, so that when we get to budget time, it isn't a scramble of where is this and where is this and do we cut this and do we understand what this is? So strategic planning specifically around our finances and the development of the infrastructure of our department is something that we do regularly. So I typically report about that on my reports. So we did fairly well coming into this next budget season. So it's no secret. You have heard that there is a lot changing, or at least in question at the federal level. And what does that look like coming down to the state? And so as a county health department, we don't anticipate to see major cuts to our direct funding of what we're doing, but we know with certainty that there are major changes happening at the state level, and that will then affect what we do at the county level, because we are, in broad terms, very much an extension of the state public health law. So, you know, those sorts of state changes that are being talked about could absolutely, you know, affect the way we do the services that we do. I'm very confident, though, that our staff and the way we've set up our services, the technical expertise that we have in the department, the way we are succession planning and strategically planning our workforce, we will be able to absorb the changes and be as flexible as needed to really still provide excellent service to the community. Some of the standards around immunization and things, again, we provide fewer of those types of clinical services in the community for a reason. Sitting with our, you know, friends and partners from TCC and our providers, there are other providers that can provide those services now much more robustly in the community. So instead, what we do is we try to act as the safety net provider for those services. So we do still provide some of those vaccine and immunization services, but we step much more now into the role of technical assistance for those partners in the community. Can we advocate for, you know, things that are needed at the state level, being a partner to our schools and our school nurses, and the school medical directors to ensure that the schools have access for their students to these types of services as well, where perhaps other providers can't step in. So that's sort of kind of the overall, you know, picture of what I've been working on and looking at what my time has been consumed with most recently. But there are some specific things I did want to review with you. Importantly, we talked at length. I'm so glad to hear that lead is just part of our normal conversations these days. The Lead Smart Partnership Conference is happening October 8th. You all received an email earlier this afternoon. Please pass that along to partners, you know, providers that you work with, staff. It is a really great day of networking in particular, because I think it's really refreshing for some organizations. I was able to be there last year, that show up and they say, oh, you all are working in this space too, because there is no lead agency. And it's a play on words because it's also spelled lead agency. So there is no lead agency. We in the broader sense are sort of that agency, but there is so much of this work happening in other partner coalitions, partner agencies, housing coalitions, the whole 9 yards. So it is, I think, a very hopeful thing for providers, for agency leads, agency staff to come and see how broadly this work is happening now in our community. Before, I think it was very much an uphill battle for everybody in the mix, and now there is definitely that sense of strength in numbers. So if you can join us or have staff, friends, partners join us, please do.
Did I read that Southern Tier Peds is getting an award? Yeah.
Where did you read that?
What was that? Sorry. I don't
Where did you read that?
In the invitation that came.
Oh, I haven't seen it.
Well, I will say Southern Tier is always really up there. It
Put
was
on there.
the different awards. I think last year the Randolph office. Side note, I will say this as well, the state, specifically for communities of concern, the state is really buckling down on a lot of this work that is happening or perhaps not happening. And it was a lot of directors across the state were sort of anxious about a new report that the state health department is going to be putting out in regards to provider compliance with lead levels. And there were counties that there were multiple providers on this list that were not meeting the standard of testing their patients. And I can report that that was not the case in Chautauqua County at all. I was very proud of that. Speaks to the dedication of our providers in the community, the technical assistance offered through Jessica and Kathy's teams, and outreach to these offices to ensure that they are up to speed and testing and providing what we can to ensure that they are getting these testing done. So that was another wonderful thing to report on about that. Any questions?
I think the reporting remains an issue there. Part of looking at the reports, providers are doing the testing, or if more so not the office issue, if the kids are going to the hospital.
Yes.
Hospitals, there's a gap and it's not getting reported. So the state had different numbers than what was on the ground. But with the team here at the Anna Powell and the rest of the team, they've been doing some groundwork. And I think they're in better shape to bring those numbers up. It's just a reporting issue.
Wonderful. Okay, so speaking of school-age children, Kathy Burgess and the community health team has been out. You may see the mobile health clinic driving around out and about. We've specifically been partnering with schools as they need and request to provide pop-up clinics. So you are most likely familiar with the 14-day regulatory rule that school-age children have to be up to date and scheduled with their immunizations to remain in school. It is obviously the intent of the public health agencies in this community that children stay in school and be immunized. So we only really provide those services as a pop-up, again, sort of safety net, because our intention is to ensure that they're first connecting with primary care and receiving regular care and their vaccinations at that point. These pop-up clinics typically are serving students who are coming either internationally to our county and maybe have not connected yet with physicians or primary care practice. But otherwise, we do have mechanisms in place to ensure that we are connecting them with primary care if not when they come and see us. The community health assessment and improvement plan that is well in the works, that is going very well. Staff member Steve Kilburn, along with our communication and admins team, is really spearheading that effort for us. There are a lot of great meetings, wonderful content coming from those meetings. And at the same time, as we know, realistically, there are very specific objectives and deliverables that we can approach with an assessment and improvement plan. We are being very cognizant that as other conversation is cropping up and we're taking very detailed notes about themes that are being discussed at these meetings, we aren't just going to toss those things to the side and say, oh, they don't fit really into an assessment plan and an improvement plan, so we aren't going to take care of them. We have other plans to ensure that networks and systems, within the public health realm here in Chautauqua County can take on some of this additional work. So just to draw your attention to a couple of those themes that are coming up, maternal and child health, access to care, a big one. Our partners at UPMC and TCC are both very actively working in this realm as well to ensure that there's access specifically in the North County to prenatal care and prenatal services. There's some really great brainstorming and ideas on the table of how we can even fill gaps in the meantime while some of this more sustainable infrastructure is built in throughout the county. Currently, UPMC is the only true birthing facility that we have in the county. So for women in Brockton, Silver Creek, the distance to travel obviously is a barrier, and oftentimes may not have access to transportation in the first place. So these are things we are very well aware of and working diligently on. Dental services, believe it or not, were a central theme and continue to be a central theme through these discussions. I'll update you a little bit more a little further down about that. Transportation, again, there are some with the planning staff that we've brought on board, the planning and policy staff are working on some pilot projects around transportation, working with our transportation partners in the community to see if there are some creative and innovative ways that we can improve transportation around some of these, health disparity areas, maternal infant child health, long-term care and aging services care in particularly. So they're developing some projects to be funded to pilot in the community. And then specifically long-term care and skilled facilities, you've probably seen or heard that Westfield is now the latest to really succumb to the issues surrounding reimbursement rates, quite frankly, for aging services and aging care. So we are working closely with those partners. While we don't, at the local level, have any jurisdiction over how these services happen, where they happen, what happens with the people, in care at these facilities. We work very closely with the aging services partners as well as OFAS downstairs on the first floor. And what we really do is we advocate for flexibilities in terms of shifting services. There's a lot of regulation around skilled facility work. It is all regulated by state DOH, really. And so having a direct connection with the commissioner of the state health department, we utilize that to advocate for expedited timelines on applications for new services to help provide new revenue sources to the long-term skilled care facilities that we do still have. So we do play a more ancillary role in the work trying to support these. But if you look at sort of the history of long-term care, the Medicaid rate does not cover the cost of service. And yet it really is pretty typical for an average person to enter or shortly after entering a skilled facility, spend down to meet the Medicaid criteria as an individual. So the majority of people in skilled facilities are there under Medicaid, and yet it doesn't pay enough of the services. And really, when the system was set up, it was set up with the understanding of more of a percentage split between a private payer and a publicly funded payer. So here we are.
But that's not the only issue. The other issue is staffing. They can't maintain staff.
Staffing.
And so the quality falls off dramatically. It's just,
Yeah, they're under duress.
it's an impossible situation. And the remaining facilities are teetering on disaster. This is really not a good situation.
They can't get staff because they can't pay for them.
That's
They don't have
right.
the revenue.
Of course.
And the other thing I find is in New York State, and not exactly in this county, but in New York State, over 90% of the long-term care facilities are for-profit. And as opposed to 100% of the hospitals in New York State, every one of them is not for profit. In New York State law, you cannot have a for-profit hospital in New York State, but not so long-term care. And so you have a 90%. Now, I used to sit on the county homes, North County Board. And to your point about revenue split, the first question on every board meeting is, what's our private pay percentage? Because private pay then was, again, this is what was sold, so it's a little while ago, but both numbers have gone up, and the Medicaid hasn't gone up much. Private pay has gone up. The numbers were, 85, 87% Medicaid. Not necessarily day one, but very quickly after. But so gross revenue was gross number of patients. Revenue was about 4 to 1. The amount paid by a private pay patient compared to a Medicaid patient. And so it's a tremendous issue. And the state's not just going to, although the last couple of years there actually has been a little more. It was like 13 years, 15 years, there was no increase at all in the long-term care rate.
Then the big push was then to get rehab patients because the reimbursement for rehab was,
For
well, now
20
these,
days.
Well,
And
yeah,
now
the
these
Medicare
patients-
rates are
Medicare.
very high,
but now these patients are going directly home a lot. They'll be getting care at home or getting very short stays in hospital because the procedures are getting better. It's,
I don't know the answer. It's very, very tough.
but then we can go to the hospitals that are getting the same squeeze again.
Keep them there.
So we are, staying very closely tied to the remaining long-term care facilities that we have in the community and doing, again, what we can to just help support and be very thoughtful about encouraging all different sorts of contingency plans, revenue plans, spending plans. So we will certainly keep you up to date with that. With that in mind, I did want to just draw your attention to the 2 QR codes at the bottom. We'll also send these out as links because really these are much easier to view on like a full screen computer monitor. But these are some data-driven narratives that our planning staff is putting together to help in advocacy efforts and to help support, again, these efforts that are needed in our community. And it's taking all of the information and putting it in a much more digestible format. So if you get a chance, review them. It's really good information, really neat data, specifically around the aging data visual. There's some great metrics in there. We've always called it for the longest time a silver tsunami, that as the baby boomers are aging out of the workforce and into needing care, that, that really in and of itself, even if we weren't experiencing workforce shortages, we will be when a larger generation is needing care and the younger generations, there's fewer in those generations to provide the work, needed to take care of them. So there's some great data and visuals there. Any other thoughts there before I move on to, just wanted to make you aware too, we're out and about doing a lot of things, a lot of times. I was recently asked to speak at the New York State Association of Counties annual meeting. It was their 150th anniversary meeting, actually, so it was very well attended. I was very honored to be asked to present and asked to present this on behalf, of course, of Chautauqua County, but also on behalf of the State Association of County Health Officials. Specifically on the topic, the economics of prevention, rural public health's value proposition. We've been doing a lot of really innovative and creative things here at our health department. And in a sort of non-traditional public health ways, it's sort of this new wave of public health that isn't so new now that I've been removed, from my younger years of getting all of this experience in my, education and master's programs, but really more of a strategic development and strategic approach to how we are setting up our local health departments, the type of work that we're doing, and looking at the roles that we have in our departments, everything from workforce development to even the fee structures and things that we're putting together with boards like yours, how we can do those things more efficiently to not only, of course, improve economic returns and the viability of, our revenue sources and ensuring that public health systems are sustainable for our community members. So not just the economics part, but really to more specifically and in a more targeted way, improve outcomes in ways that we can know are being successful in the ways we need them to be successful. So it's a neat time to be in rural public health. It's a difficult time to be in rural public health, but if anything, the silver lining is that it affords us the opportunities to do new things that we've never been able to do, that have the potential to really improve, on some things that maybe we needed to. So that's the hopeful message that, we tried to bring to the state, and really beef up and talk about all of the assets that we have in rural areas. So often, especially in a state like New York State, rural counties can often be sort of forgotten about, or looked at as, kind of like the lesser than. So we were there with a lot of evidence to prove the opposite, that we have the natural resources and environment to support amazing health outcomes. We need to be good stewards of those resources. So that was the call to them. And I was glad to be there. And our county executive was able to be there, as well as some of our other county leadership. So that was a wonderful opportunity.
Can we view that online?
I thank you for leading. I think you can view that online. Actually, I'll have to send that out to you as well. Although I don't love being on camera or pictures, so watch it with the camera off for me.
With audio.
There we go. But the other page that I provided, this was a poster that we created, that was actually also at that venue and will be used in some other venues. It's a snapshot of our department in rural health and what a rural health department can do in 1 year. Of course, this is just a small snapshot. We also had our Parks and Trails program that we just ran all the numbers for this presentation. Over 130 individuals that the overwhelming majority of them having never visited a local trail or park, the specific ones that they visited, did so over the course of this program. So that alone, we know that outdoor activity, green space, fresh air, physical activity, there's really nothing wrong with that. And then along the way, we show all the videos of how you protect yourself against vector-borne illness when you're out on these trails with ticks and things like that. So we had the opportunity to visually show all of that as well. So that's what that piece of paper is there too. So you can refer to that if you ever are out talking up the health department. We would appreciate that, certainly. But yes, I'll also send you the link. I do believe I can have that recorded.
Can I ask 2 questions?
Yes. Mhm.
It says 825 immunizations. Is that just 825 children or 825
The
immunizations?
majority is children, but it's immunizations. It includes also,
It's in,
yeah, there are some adults in there. And of course, also
doesn't seem like very many.
we are the safety net provider in this service.
Okay, so
Um,
it's just, okay.
It's just what we do. So it's not, that
Right.
is not
Yeah.
how many people have been vaccinated in the county.
It's
No, it's
just-
far more than that.
Okay.
It's just what we've done as safety net.
Okay.
So as a follow-up to that, in the office, parents or a adult brings the child to for the vaccination. Your van shows up at school. How does that process work?
So to ensure that that we are giving.
Consent.
Okay, so consent, there is a paper consent form. Typically what we do is we're working with school nurses or the medical directors beforehand. That the consent forms are sent home with the children ahead of time. They come back to us. That's basically like their scheduled appointment at that
Okay.
point. that we know. And then all of our staff has access to the NICES system. So they're in there checking to make sure that this is a vaccine, that, it's not a double vaccine. They even,
Right.
yeah. So they're checking that.
I was actually a beneficiary of this system today and yesterday. We have an exchange student and the school nurse called me yesterday and said, we just got his vaccines translated and he's missing 4. And she said, and the pop-up clinics tomorrow at his school. And so she emailed me the consent form. I filled it out, faxed it back, and he got 4 vaccines today. It was perfect.
Okay. No, I was just,
I mean, we did not set that up, but that is really the purpose of, of what we're trying to do. Any other questions there? Or,
Just have one more. The 904 early intervention
yes.
participants, that seems like a lot.
So that, you've heard us come to
Yeah, I
the
know.
legislative meetings
It's like-
about that. Isn't that
Scary.
amazing?
And it could be a lot more.
Yeah,
It
I
could be a
was gonna
lot
say
more.
that.
We have to hold ourselves back and connect them to other agencies and resources. That number could easily double.
Yes.
This is just what our service coordinators are taking care of in the community.
Yeah.
There are other programs like JCLC through the Healthy Families, programs that are also doing this type of work. Yes, it speaks to the need in the community. It also speaks to the validity. This was one of the things that we had talked about. Early intervention, and not just in terms of like our program called early intervention, intervening early with, developmental milestones as really the marker for these children. The returns on investment in their health outcomes, but also the economic impact, it's almost invaluable.
Oh,
I mean,
I
I
know.
think it was like I can't remember, I think it's a 4-to-1 or 5-to-1 dollar investment that we see, basically $5 return every dollar that we invest. The other neat investment one too, again, that we're trying to really promote with these younger families, the early intervention families included with our parks and trails programs, the green space initiatives have even a crazier return. It's something like $7 to $14 return on every dollar that you invest in green space in a community, particularly because those are generally and broadly accessible to every person in a community. So the standard is a green space basically accessible within a mile of every resident. Now, we literally have that built into who we are as a rural community. A lot of times it's just the smaller municipalities creating the access through a sidewalk or a trail to get there, that sort of thing. But we think about that specifically in regards to our families that are experiencing, developmental or physical disabilities. Green spaces are invaluable to those families. And I think specifically of Celeron has done an amazing job with their playground and park. They worked hand in hand with the resource center to ensure that the swings and the toys, the playground equipment was all ADA accessible as well for students with or children with disabilities. So there's amazing things happening in this realm, but it is very forward thinking. It's not reactionary. It's very much strategic planned, interventions that, investing our dollars into, but the return on all of them is great.
I mean, that's important. Very important. Early intervention and the return.
Yeah.
So does the county have more capacity for early intervention? I mean, services? Are you
That's all
capped
based on, it's all staffing. So the state, basically a regulation within the mandates for the program states that our service coordinators should carry a caseload around 60 to 70 children each caseworker. So that is where we had worked with our legislator. Our legislator was very supportive of improving the budget line item in that program last year to ensure that we could have enough caseworkers so that we didn't run into a wait list for our services. So we've not yet had a wait list for any of our early intervention services, but that is a direct result of partner agencies in the community who are doing some of this type of work around the issue as well. But more caseworkers that you have, you obviously then can bring in more children to the program should that need arise.
But I recently heard that there wasn't enough and people are being turned away.
No, and I
That's
think
not
we,
true.
we appreciate, we sometimes don't get to see the back end of it because we deal with the early intervention folks. But the support of our legislator and providing those dollars, in the time I've been here, we've never heard that we have referred a kid or a pediatric age patient and no, we can't take them, our caseload is full. There's always been receptiveness, and even if sometimes took a little bit longer, they do get evaluated and they get seen. So very proud of that service.
One of the unfortunate areas where you don't have that is trying to get someone evaluated at OSHI.
Yeah.
The ones who are, that's 6 months. I mean, it's
Yes.
brutal. Parents are like,
That was the idea of the Center of Excellence
I know.
of the program that we were working. So
I know, that's the hard one.
Why or how?
Oh, it's just the numbers of kids that are being identified as having developmental delays of significant, these are usually kids who are
Yes.
on the autistic spectrum, and to get them, evaluated there, it's just 4 or 6 months sometimes.
Or longer. We've had families wait a year to get
Yeah,
in for
yeah.
But it's
assessment.
an OSHI thing, it's not.
No, it's not us. We're
Right.
actually, most of us are using tools that identify these kids, identify these kids early. And the parents are also very active at saying, hey, I think there's something going on here. And then there's this long delay, which is
To get
really,
an actual diagnosis.
That's right.
Which then allows you to get
Generates.
services.
that's
Yeah.
when generate services. That's,
So that's more of the medical, and then also
Yeah.
speaks to, sort of the seriousness or the medical acuity of the cases that they're seeing too. It does take, it's a longer evaluation process.
Mhm.
But getting those diagnoses are so important because that is what unlocks the services. That is what allows Department of Ed then to provide further services in their school age through IEPs and 504 plans.
So in that meantime, they just.
In that-
Wow.
yeah.
Yeah.
And OSHI is the only place.
Yeah, I was gonna say.
Well, and this goes back to provider deserts. I mean, there's.
Well, I
we
just
have
said,
to
you
have-
said, is it 8 counties, then they're probably.
Yeah.
Trying, so it's not.
I think it's a pediatric psychologist that has to,
yeah,
that's the
it's
specialty
just,
that we don't have.
or it could be a developmental pediatrician
Developmental
too, / neurologist making diagnosis of autism. I did hear, and I'm sure some of you, that there is now programs that are web-based, and pediatricians or family docs or nurse practitioners can do training and do level 2 tools for autism diagnosis, which will not be diagnostic, but you can put that in front of the school board and get services. And the training is not that, so people are they're kind of very innovative. They're thinking of things, but it requires time, it requires training, it requires commitment on that practice when you're trying to see everybody else. But that's where it's going, that the primary care doctors, pediatricians will have to do that level 2 tool, because level 1 is MCHAT or basic screening in the office. Level 2 is some of those screens that are, so you can get services, because if the kiddo is 2.5 and 3, they can't get those services, then where do they go?
Right.
So that's where it's going to end.
And even just, we think from, again, the public health, sort of the social determinants of things too, when these services and these, screenings can't be done locally, to even get to OSHIs for these families, is a barrier. So that's great to hear. There's some discussion.
Yeah, you could get a lot of more referrals if some of our local pediatricians are able to do that. Yeah.
Forgive me for being ignorant, but everything's done online, Zoom, it can't be that,
it's just a matter of volume of patients and the number of providers at that end that can, they're not against seeing people, they just cannot. That's right. Yeah.
The other thing I've been told, because that was actually a question that came up in a state meeting that we were just in regards to, can we increase, the flow of patients if we did something more But basically the consensus of most providers, and you all would be able to speak to this much more than I would, but specifically when you're working at the early intervention stages, like 0 to 3, you really have to see that child.
Sure.
They're nonverbal, there's so many cues that you wouldn't be able to pick up on through a more telemedicine setup.
No,
Um,
I kind of figured that.
Yeah. But that's a very astute question because we are literally turning over every stone, what else could we be doing to continue to improve systems?
So if we had one of these specialists in the county.
Or it's a long list of if we had one.
Yeah, I know.
Yeah, they're just behind.
Dennis.
Put it on our recruitment
Yes.
list. Because but I mean, these are,
We need
Yeah.
more than one.
I mean,
Dermatology, rheumatology,
Yeah.
it could be
endocrinology.
something that,
Yeah.
from a public health standpoint, the county, joins in the recruitment process for something like that.
And even then. So people don't want to be one either.
No, it's very difficult. And they would be filled up immediately,
Yeah.
booking out a year.
Yeah.
The first time.
Or however get a day off. And it's
Well, it
solo anything.
took my newly adopted son till the age of 25 to be diagnosed because his birth parents just felt it was behavioral and would beat him if he showed signs, and that's more common than I ever could believe.
Oh. Okay.
Okay, so, moving on, just some quick updates for you. Our Public Health Fellows Program, we've been keeping you up to date with that. The funding around that, still has been extended. But we can report that 3 of the 4 fellows have actually been hired into permanent positions supporting public health locally and regionally. So that's a wonderful thing. One of them, in fact, is coming and joining the health department in the lead team and the lead programming work, doing community services outreach work. So again,
Successful program.
it's a successful program and it's done really well, specifically in retaining local people for local public health work. So I'm very thrilled about that. I'm very happy for Jessica's team. Pediatric dental services, so a quick update there. There is a lot going on in the realm of this. So first and foremost, thank you to all of you for your support and your advocacy around this. It's coming back around in multiple ways, and I hear that you all are talking about these things. Funding in particular, so we were able to reach out to some of the funders and some of our partners and collaborators in the mix are really sort of taking now the lead on some of the funding around this. But it looks like we're going to be able to have whatever sort of pilot program and phased in programs that we're talking about right now. It looks like those things, we shouldn't have any trouble finding funding for them. So that's a wonderful thing. Right now, what the point that we are at right now is developing with our partners and our collaborators what the best first phase pilot program of this is going to look like. And fleshing that out, all of the details, what barriers are there, what assets we have. And of course, that's my favorite part because it's all conceptual. And then we have to try to make it happen after that. But conceptually, there are some really great plans coming together. The Superintendent's Association has been looped in, so they're being kept abreast of everything going on so that they aren't worried or panicking that the service isn't going to be there. We are not over-promising by any means because we know that doing anything of this caliber and sort really takes an army and a village in a lot of ways. So we're just in the thick of it at this point. But things are coming along really nicely. So thank you. We've gotten a ton of support from elected officials, partners like TCC and even UPMC in the mix of things too. I mean, our schools have been great. The local private dentists inviting us to their meetings as they meet sort of informally, and then CHN as well, really helping to facilitate the sort of infrastructure and the funding and all of these things around it. So again, would have loved to have not been handed this situation last minute and after decisions had already been made at the UB level, but we can't complain. Complaining is worth nothing at this point. We just need to get out there and grab the resources that we can to ensure that these services continue for the children in our community.
I throw something out a little bit to it, a little bit of a minefield, and I wish Dr. Pender was here to speak to, but, fluoride,
Yes.
because
Oh, no.
at least the mechanics that I talked to.
Yeah.
Say, this is all great. We need fluoride in the water. And I'm seeing more and more places say, no, like within this week, a bill was introduced, and it's going to pass in New York City to ban fluoride in New York City. Again, I can pretend to be an expert in it, but it sure seems to me that it's moving away from fluoridation of water, and at least what I read, which may or may not be accurate, we need to be increasing. And I just wonder, advocacy perspective, I mean, whatever others think, is it a role? But otherwise, is it too divisive? Is it whatever? Because this town has it, that town doesn't have it. I mean, there's Dunkirk for underwater. There's an argument about joining the water system because one's fluoridated and one isn't.
Rick,
No,
there's a
neither
perfect
of them are.
experiment that was done in Canada with two very, very large communities. And one took the fluoride out 5 years ago, one has it in, and the data are outstandingly in support of fluoridating. the water.
Yeah, that's what
I know, and these are large population studies.
Yeah.
You're dealing with idiots, and you can't, it's really hard to deal with that.
I
Because
didn't know there was a place.
this
for
has
those
been
for us.
well documented. The
Decades.
data is there, are there to support low dose, sure, at a higher level, it's not good, but if it's very well regulated,
Yeah.
you end up with fewer cavities in kids. That's all. It's very simple.
It is certainly a public health discussion. It's certainly a public health initiative and intervention that has been widely used. I think where things are getting lost in translation and sort of misinterpreted in translation is there's different ways of, fluoride application or access to fluoride. And even how, and I do not know enough about this, and Jessica could come back maybe and talk to us about this if so choose, but even the type of fluoride used in water. I mean, there's even discussion about that. I think that's more so where it gets lost in translation, where then it's just you throw everything out then with the bathwater.
Maybe some future media education. I just throw it out there because I don't know. I just, when I hear things like this and I see us removing fluoride or not putting it in our waters, this New York City thing, it doesn't mean it's going to pass.
Well, it's sort of funny because it does come right back to the dental issue and
Yeah.
with
So I throw it out.
with the initial discussions that we had where, the justification that was given to me was that, well, you realize that we got to pull this resource back to inner city Buffalo because some of these communities don't have fluoride in their water supply. And then I laughed and I said, you don't understand anything about rural health then, because 90% of the children in our community have no fluoride in their water supply because they're drinking from wells or they're drinking from smaller municipal well systems that don't provide fluoride or small. So it's an interesting conversation because in Chautauqua County, there is much less access to infrastructural fluoride systems than in your more urban areas.
Yeah.
So typically where rural communities see the most effectual population level, community level approach is through pediatric dentistry, through providers and doing the coat, the fluoride coat. There's really great discussions happening right now. I had a chance to meet with the State Commissioner of Health last week, maybe. I've been all over the place the last couple of weeks and can't quite remember what day it was, but this was a topic in particular that we talked about around the dental services issues that we're experiencing in rural areas. And the fact that fluoride application really, it's not a high level technical service that needs to be provided. I believe even RNs, nurses. And
You can teach your medical assistants, they can apply.
Yeah.
MAs, it's simple.
right. So
It
we're looking
might,
at some
it
other
might
services.
blow everything up too. You get involved and it gets to be a Or it may be a net negative. I don't know. I bring it out there. And I like what Dr. Burke said when you talk about a study like that with two large
Oh, yeah, it's, the evidence is
population. I
overwhelming.
mean, there's a lot of stories, but I mean, things like that, but sometimes facts don't matter. I realize.
Yeah, we used to get,
Well, they're facts in there.
we used to get fluoride treatments in school.
Yeah.
Yeah,
Yeah.
so they're kind of talking
Yeah.
about models like that again.
Why did that ever go away?
Can there be?
It's just like every generation has to learn not to smoke.
Yeah, yeah.
Yes, yeah, good. Yeah,
Yeah.
Okay, well, I just throw it out there because it's, I don't think it bothers me.
no, these are great things and you are spot on. This is all the stuff that we are discussing and working on and talking about. And got some great commitments from the commissioner himself in regards to the dental work that we're working on that, you know, he has committed, and I have the names and numbers of the staff that work directly in his office, to help ensure that should certificate of needs, you know, be necessary to do this work as pop-up in different locations, that they will help us, expedite those applications and things directly through their office. So I was very pleased, with their willingness. He probably has thought, I do not want to hear from this lady one more, because he has.
Say it.
Yeah, just say yes to us and I go away. So again, thank you for all of your support on this. It's a long and slow process, but it's happening as quickly as I've ever seen something like this come together before. That speaks to our community.
As far as access in Buffalo, I mean, they've got the UB dental clinic there. I mean, and it's easy to get to. The public transportation goes right there. I take people up there 3 times a month now, you know, from our area. That's 2 hours. They're right there.
Well, and part of it,
Yeah.
I don't want to villainize myself, you know, because about with the UB system and program, their program, from what we're learning, is also downsizing.
Yeah.
So some of their availability of even just having enough practitioners to do that
Oh, yeah.
work,
Yeah.
that's sort of what is becoming their central focus now.
Though they've just hired several new attending supervising dentists. They've got a whole new crew in there the last couple of weeks.
Well, maybe we'll
Yeah.
reach back out to them.
Yeah.
Hire them from Chautauqua County.
No.
We did send them a certified letter to requesting, in writing, a formal transition plan and really providing us what, you know, the services were that they were doing. And, that was sent by certified mail and received by them on August 14th. And we're patiently awaiting a reply on that. It was signed by our county executive, Senator Borello, and also Assemblyman Moltar. So, again, it's gotten very good support for everybody, but, we don't wait. We come up with contingency plans and we get going, and, we will keep you updated on that. And then lastly from me, just in terms of the strategic planning, because workforce has been such a topic of discussion. Again, I want to highlight, the really great efforts on behalf of our division leads, the culture that they are really working hard to ensure is encouraging a positive workplace, something that people want to be a part of. I think it speaks volumes that our department is down to now only 2 open positions, and that they're not even technically vacancies. These are positions that were created out of revenue streams that are not locally funded, but included in last year's budget. We were approved for them. So now it is just working through the HR process and getting people onboarded into these positions. The one of them is in particular one of those planning and policy division positions that will help us to continue to ensure that our funding is sustainable, diversified, so that we can rely less on county taxpayer dollars, and streamlining our services, being an aid to our division leads so that they can be the technical experts in their programmatic areas and not also have to be funding experts and the reporting experts and the compliance experts that they've had to have been all of these years. So very excited to bring that forward. Any questions?
Congratulations on your retention and filling of
Great.
vacancies.
It's impressive.
Impressive. Other is the next on the agenda. And I'll bring something up just briefly. Speaking of hot button issues, I just wanted to talk about the COVID vaccine and what the health department might be able to do just to help with ease information access to the public. There's a lot of political baggage around the vaccine this year, and there's conflicting recommendations that are coming out from the federal and the federal level versus the state level. We follow the New York State guidelines, and I think just making those broad and easily accessible will be helpful. We've had to do just a lot of internal education at our own facility to kind of bring everybody up to speed with what those guidelines are. We've also run into a lot of patients and community members having confusion about or being asked to present a prescription to get a COVID vaccine, which should no longer be needed in New York State. I think the pharmacies got stuck between the federal and state recommendations, not knowing who to follow and what to do.
And payers.
And it caused a lot of uncertainty and clearly barriers to access to vaccination, which were unnecessary. So I don't know if you guys are planning anything to put out or help
So
with
we're working with the state association. What we've sort of thought would be the most effective way of messaging, because there is the Western region really doing something together in terms of messaging, because there are so many practices that are in multiple counties or tri-county, or people who are working in one county and driving to the next, or might be healthcare workforce in one county, like up at Oshais or in Ozark, but living down here. So we were waiting just today, the ACIP meeting was happening. So, and then also in recent days, and cannot remember my timeline, but state commissioner did come up with the standing orders. And then Governor Hochul is saying that she's committed to ensuring that insurance will pay. That shouldn't be a barrier and that sort of thing. So we're waiting sort of, as a civil service under a government umbrella, waiting for all of those pieces to align before we come out regionally to say, because we don't want there to be further community.
Right.
So we don't want to say like, well, these age groups are, but not these age groups. So we're sort of waiting to make sure there is a solid message and they're doing something regionally.
But just anecdotally, literally last week, myself, my wife, and my mother-in-law, all of which are over 65, we went to 3 different places intentionally, and we went online, made an appointment, got an appointment the next day, went in, no problem, being Tops, Walmart, CVS, and it was, again, over 65, but it was like, no problem. Go in, there was no question of insurance, about a doctor order, there were no hassles. It was easy. So again, maybe being over age 65, though, had something to do with it.
Well, and I think on the
Well,
heels of.
I got turned away from one pharmacy, I'm over 65, and ended up getting at another, and then they charged me,
Yeah, I had no.
and then I got a refund a month later,
Yeah.
because
I think this
it was
last
a lot of
week and a half, it all
confusion.
smoothed out a little
Yeah.
bit, but it was very bumpy.
Yeah, this was a few months ago when I did mine, yeah.
Yeah, with commissioners. Yeah.
Yeah,
With commissioner standing orders, I think, that helped reassure, and they specifically cited pharmacies
yeah.
in those standing orders. So I think that brought a lot of reassurance because, they have an interesting, they're a for-profit model. So they're concerned about those.
Yeah.
Is there anything else under the other category anyone wants to bring up?
We didn't have any Atuba violations. Good.
Maybe they heard we're working on something.
We did take a minor out and did a full day of checks and nobody sold to them. It was a lovely day in the
Cool.
Atuba world.
They're hearing the stirrings of
Yeah.
the conversations.
Oh, yeah, we're, John, especially when he does his little undercover talks, he engages the owners in conversations and they are scared. They're noticing both Chautauqua, Cattaraugus County, a little bit in Allegheny. They're more wary. But when he convinces them that he's harmless, then they take him into the back room so they can show him the illegal stuff, But
Was there any update to the ACE I believe it was, the Fairmount Avenue location that we made a recommendation that was then sent to the state about the shutting of that, revoking of that. Did that ever?
We haven't heard final word about the license being removed yet.
They're still open.
Yeah,
Yeah, they're,
So we have some
Yeah.
justice.
Yeah.
First.
well, unfortunately, the State Department of Health folks have had some staffing challenges themselves with different funding issues and different, reprioritizing program areas and whatnot. So some of these things are also moving slower for us. Yeah.
Can I have a motion to adjourn? That's a, Dr. Khan.
That's a
is
motion.
Motioning with a football throw to the
Okay.
door.
That's not an
RPO
motion.
Rick is gonna make his, seat at his destination.
And because of football, it took 3 hours for me to get here from Niagara Falls.
I
Or you had to go through all the.
3 hours. I went 10 miles an hour from Niagara Falls to Orchard Park.
You gotta plan that into your.
I just didn't dawn that it would slow me down that much, but yeah, doubled the time.
Family's doing well, Betsy.
I missed.
Yeah.
Jim's traveling or is in town?
He just got back today.